When it comes to soft tissue management and intraoral scanning, a TRIOS scanner can be an invaluable tool to achieve good prosthetic treatment outcomes. This includes achieving proper fit, functionality, durability of the prosthesis, and ensuring the patient's comfort and satisfaction. Now, there is a prevalent notion that the scanner can scan through the gingival sulcus and scans the preparation's margin line. However, it is important to understand that what TRIOS sees, TRIOS will scan. Although the TRIOS has a focal scan depth of 17 millimeters, standardized methods for soft tissue management prior to scanning are still essential to achieve accurate results. There are 3 gingival retraction methods that should be considered before scanning: mechanical, such as one or double core technique; mechanical chemical, such as gingival retraction paste; and surgical, such as electrosurgery. Here we have a case from Dr. Austin Vetter from the US, where he used a combination of mechanical and mechanical chemical methods, including burr and irrigation to remove excess soft tissue, ferric sulfate as hemostatic agent, and double core technique for soft tissue management. To determine whether tissue isolation needs to be performed, preparation depth needs to be assessed. The margin line should be clearly visible for the scanner. Moisture control is also important to implement. Blood and saliva will have a direct impact on the scan quality and treatment outcome by potentially creating false concavities and surfaces on the preparation and surrounding areas. Now, let's quickly summarize where a margin line could be placed. Supragingival margin line preparations possess great margin line visibility, whereas equigingival and subgingival preparations do not. Therefore, tissue isolation is required on these 2. There are 4 workflows in which soft tissue management can happen at different stages. Here, we will introduce the basic guidelines using the standard workflow with no pre-preparation scan selected in the order form. We will take a walkthrough in the following steps: prepare, assess, soft tissue management, scan, analyze, and send to lab. Begin by scanning the patient's upper and lower jaw. This can be done by either the dentist, dental assistant, or hygienist. After the tooth has been prepared, trim locally with the trim tool. Perform soft tissue management, moisture control, and scan again. Once the preparation has been scanned, it is highly recommended to turn off the shades to assess scan quality. You will be prompted to mark the tooth. This will help you visualize the areas that need to be further scanned on the preparation and a proximal contacts. You can perform additional scans by enabling the zoom tool, which amplifies the scan depth to help capture hard-to-reach areas. To protect the soft tissue that you've scanned, use the locked surface to avoid adding any more images to that surface. Even if the soft tissue collapses or bleeds after, passing the scanner again over the surface, it will remain unaltered. It is time to scan the patient's static and dynamic occlusion. In this step, the clearance tool can be very helpful to assess adequate occlusal reduction. If your preparation is too high, you can go back to the scanning step, trim on the scan, trim on your patient's prep, and scan again. This action can be performed multiple times. Once you are pleased with the quality of the preparation, you can post-process your scans in the analyze step. This action will allow you to see the final quality of the scans and how the margin line will look in the dental laboratory. Here, you have 2 clear examples on the same patient where tissue management was performed and was avoided. Take a look at the second video. The margin line is clearly visible. So, if you are unable to see the margin line after post-processing the scans, it is highly recommended to go back to your patients to either perform more preparation or more tissue isolation, trim on the scan, scan again, and post-process. This exercise can be done multiple times, as much as you need. Now, after your margin line is clearly visible, it is time to send the scans to the dental laboratory.